You're listening to Democracy Watch, the News Collective's weekly news report, bringing you alternative and undercovered current affairs from Vancouver and the Lower Mainland. My name is Alex DeBoer.
I'm Max Newman.
And I'm Joshua Azizi. It's Thursday, April 18th at 5:06 p.m. We're broadcasting from UBC Vancouver's campus on the ancestral, traditional, and unceded territories of the Hunkamanam-speaking Musqueam people.
On today's show, we're focusing on Vancouver's opioid epidemic.
April 14th was the 3-year anniversary of BC's public health emergency. Since that date, more than 3,600 people have lost their lives to overdose in BC, with more than 1,000 of those deaths happening here in Vancouver.
Well, and since 2016, the death rate has been rising each year. In BC, the number of deaths from during poisoning currently equates to almost 3 deaths per day.
Yeah, 3 deaths per day, that's a lot. And this past Tuesday, April 16th, myself, Alex DeBoer, and then Max and Josh, who are here in studio with me, as well as Ben Mussett, who wasn't able to be with us today. That sounds really tragic. He just wasn't able to be in studio with us. We all went out to the National Day of Action on the Opioid Epidemic. This was a rally and march that was held in downtown Vancouver. It began in front of Insight, which is Vancouver's safe injection site, and it ended at the Vancouver Art Gallery.
And we spoke with a number of marchers at the event, and we put together a news report to give to you, dear listeners, a sense of what it felt like to be part of this day of action and what the event itself was all about.
Well, without further talking, let's go take a listen.
Here we go. So we're here on Hastings and Columbia in front of Insight, which is Vancouver's safe injection site. My name's Alex DeBoer. I'm here with
Max.
Just Max.
On April 16th, CITR News went downtown to cover the Vancouver National Day of Action on the overdose crisis.
Yeah, so what do we have here? A crowd of, 50, 60 people? What do you think?
I would say maybe over 100.
Maybe over 100?
Yeah.
Okay. I can't count.
Pretty crowded.
On the sidewalk, and there's a tent, and there was a band playing, and...
Myself, Joshua Azizi, as well as CITR's Alex DeBoer and Max Newman, stood in a crowd outside Insight before a march for safe drug supply began. This event marks the 3rd year since the BC government declared a public health emergency in response to a drastic rise in drug overdoses.
Yeah, so we're going to start the march soon. There's some signs on it. We'll try to read those.
Folks held up signs all around us. They read, "Freedom, evidence-based care, decriminalize." Another sign lying on the ground read, "They talk, we die."
Imagine a world where the choice to use drugs wasn't illegal, and those who choose to use drugs didn't have to turn to the black market. A world where every purchase didn't mean a potential intimate dance with death, or a game of Russian roulette, only instead of 1 bullet in the chamber, there are 5 in a 6-shooter. Imagine a world where the drug you asked for was the drug you got, and only the drug you got. A world without worry, wondering what substance your drug of choice is cut with, and if it'll kill you. Imagine a world where buying drugs was as easy and as safe as buying alcohol, marijuana, cigarettes, or even coffee.
Since the province declared a public health emergency 3 years ago, nearly 4,000 people in BC have died of an overdose. The deaths have increased every year, with over 1,500 people having died in 2018 alone. This year's march was centered around the theme of creating a safe supply for drug users. Since the drugs in the black market are too contaminated with dangerous substances such as fentanyl, the march's organizers argue that a safe, regulated drug supply needs to be created in order to prevent further deaths.
This imaginary world I just described needs to become reality today. We need to demand it. The world we live in now, the way we are currently living, is not acceptable. The fact that over 10,000 Canadians have died of fentanyl poisoning in the last 3 years, and drastic measures weren't immediately taken by our government to ensure that even one more citizen wasn't at risk, is appalling and not acceptable. Drugs are not the problem. How we treat each other is the problem.
The crowd included a handful of reporters, drug advocates and users, as well as one Vancouver City Councillor.
Would you mind telling me who you are and where we are right now?
I'm
Jean Swanson, and I'm a city councillor, and we're at the beginning of a demonstration of Overdose Awareness Week to call for changes that will stop the deaths.
Have you come to this event in previous years?
Yes.
Have you seen much change over the last, I think it's been 3 years since it was declared an emergency, an opioid crisis?
No, there's still huge numbers of people dying, which is a crime, really. Yeah. We need a safe supply.
Do you feel as a city councillor you have much power to affect that, or is that more at other levels of government?
I think our city is taking a lead on this. We had a unanimous resolution calling for safe supply, and other levels of government have to catch up with us to stop the deaths. And the other thing is, we really need to give a huge shout out to all the residents of this neighborhood who are going around saving lives with Narcan because of all their work, which is unpaid, unacknowledged, and there's no support services for them. But because of their work, the death rate from overdoses in the downtown east side is way less than it is in other parts of the city. So, yeah.
Is there a way that their efforts can be better acknowledged or compensated?
Well, somebody could pay them. But as it is, it's just ordinary people carrying around their Narcan kits and using them when they need to, and it's really great that they're doing that. Yeah.
Okay, thanks, Jean.
Back in December, Vancouver City Council approved a report that made a number of recommendations to expand harm reduction in Vancouver, including creating a space where drug users can access a clean drug supply. Though talk of drug policy can be tedious, it's this kind of policy that saves lives.
Okay. Well, my name is Chase Dennis. I am currently in recovery. I'm in a treatment program.
Chase is one of the marchers, and he has felt the very real impact of drug policy.
I was a fentanyl user for about 2 years, and this issue is really important to me because I have numerous friends who've died. I've overdosed 3 times myself. I think it's important to have a safe drug supply for the people who are using, and harm reduction is important. I'm here for myself, but also for all the people that have been affected that were close to me as well.
And so why is this march important to you?
Because I think that outside of the community that's directly affected, a lot of people have biased views as to why it's important to have a safe drug supply, and I hope that this will increase awareness as far as that goes.
I asked Chase what creating a safe drug supply would mean for him.
So having options as far as clean supply of drugs so that people know what they're getting, and we already have services where people can use those drugs in a safe environment and be monitored, but currently there are no options for fentanyl or heroin users to be able to get something safe, and I think it's important to have those users know what they're getting and have that option.
Chase thinks that some people who don't know drug users are apathetic to their struggle. In terms of government policy towards illicit drugs, Chase remains hopeful.
I think that we're well on our way. I'd like to look to Portugal as a model for that. What they've done there has been very effective. And, we have the safe injection sites. We have a law enforcement that's relatively helpful in the sense of not prosecuting people unjustly. And I do think that in general, society as a whole is starting to look at these issues in a way which is conducive to better change in that regard.
And you mentioned Portugal. Do you find that decriminalization is the answer?
Yes, and I think we have a pseudo decriminalization. I mean, myself, I've been arrested twice with possession and in a trafficking capacity, and I think that the police are kind of starting to have a different approach to how they handle that, especially with first-time offenders. But I think decriminalization is a good start, but without without a supply of clean drugs, decriminalization might just be increasing helping the drug supply to be still dangerous. So I think both are important.
And you referred to what I guess the Vancouver Police is doing right now as like a pseudo decriminalization. Why do you think it's a pseudo decriminalization?
So, for people who are using, who are just users, having a personal supply is generally okay. There aren't many arrests that are happening for people just using, and they tend to focus on the larger scale trafficking. And even for myself, when I was a user and I was helping myself, or I was selling drugs in order to maintain my habit. They have a softer approach when dealing with people like that, which I think is also good because then they're able to put the resources into taking down the people who are really in charge, the kingpins and stuff like that.
One notable group who appeared at the march was Moms Stop the Harm, a network and advocacy group for parents who have lost children to the opioids crisis. Moms Stop the Harm was founded by Petra Schulz, whose son Danny died from an accidental fentanyl overdose in 2014. News Collective reporter Benjamin Musset interviewed Schulz before the march to hear her perspective on the overdose crisis. Like many of the attendees at the march, she echoed their demands for a safe supply that could keep people who use drugs from dying.
They're dying from what they buy on the street. Because much of what is on the street is tainted. It's fentanyl or fentanyl analogs. Even people who don't want to take opioids end up having their other drugs such as methamphetamines or cocaine and other stimulants. They could be cross-contaminated or intentionally contaminated. We don't quite know what it is. It's probably a combination of both with fentanyl. So that's what causes a death, the toxic street drugs. And there are all kinds of other things in it, like they're cancer-causing toxins, It's just really a toxic cocktail that people buy on the street. And we feel that the most rapid and most effective way to save lives is to give people who need drugs safe pharmaceutical-grade drugs. And the idea behind the Compassion Club is, we already have models like at Crosstown in Vancouver. We have models where people get injectable opioid agonist therapies on prescription. But that's kind of one doctor, one patient. It's high intensity. It's very expensive. It reaches few people.
There's only 100 people or so, right, involved in that program.
100 people, and there are 2 trials underway in Alberta, 2 programs, up to 50 patients each. They're just ramping up. They're not even near capacity. So they're just not effective in reaching the number of people that need to be reached, and that is really the idea with the Compassion Club. Also, to really put it in the hands of people who know best, who are the users, and for them to handle and distribute to eligible participants. You'd have to establish eligibility criteria. This is not for the kids that come from White Rock to head downtown to see if they can buy something at the Compassion Club. That's not the intention at all. It's for people who are using and are dependent on these drugs to make sure that they have an access to a safe supply that is not tainted.
Likewise, she also discussed how decriminalization could help address the overdose crisis.
We feel that will go a long way to reduce stigma, and that would allow us to shift some resources from criminal justice into health and social services. So that is important. But our group, we feel that, and many other groups like the Canadian Drug Policy Coalition, feel that in the long run, we really need to move to legally regulating all substances based on public health. What we have right now is, for example, alcohol, which is quite a dangerous substance. It's lethal in many ways. It causes cancer, it causes traffic collisions, it contributes to domestic violence and all these things. And yet it's legal and we advertise it. And we have these safe consumption sites called bars and restaurants where people can go and safely consume this product that has the potential of being very harmful. And we try to mitigate harm with education around fetal alcohol syndrome and those kind of issues, about not drinking when you're pregnant. And that kind of harm reduction approach should be applied to all substances. And that is really, if we get there, then we can cut out the criminal element. We can end the war on drugs. And we really take a public health approach to this problem.
However, she finds that the stigma that surrounds drug use and people who use drugs prevents both people and governments from taking hard, concrete action.
There is still so much stigma, and people perceive substance use as a matter of choice rather than a health issue, a matter of bad choice. And often they blame the person, and the idea is, well, why don't you just quit? And people don't understand that you can't just quit. And so, these kind of measures and announcements, while they would save lives, they probably don't have mass appeal in an election year. That is my personal analysis around it. So
to Petra, one of the most effective ways to reduce this stigma and affect positive change is to lead with the personal stories of those who have been affected by the overdose crisis. This includes not only the stories of those whose lives have been lost, but also the testimonies of family members who have lost loved ones from the opioids crisis.
The mistake we made and the mess we are in is that we didn't talk to the people who were most affected. When, for example, Oxy-Neo was reformulated, when OxyContin was reformulated to Oxy-Neo and made tamper-proof, and people who were using it, like Danny, moved to street drugs like heroin and eventually fentanyl because heroin was no longer available. Do you think anybody asked Danny, hey, Danny, what are you going to do if you don't make this available anymore? He wouldn't have said, you're taking OxyContin away? I guess I'm going to quit. It's done for me. No, he would have said, I have to find something else because I struggle with addiction. I can't stop using this stuff. So what we really need to do, and what the Canadian Association of People Who Use Drugs always says, nothing about us without us. And that is people who use, but also their families, because ultimately families are greatly affected by this, as you know. And so telling our stories is part of illustrating that we can't make drug policy, or as a matter of fact, we can't make health policy, period, without talking to people who are most impacted by that policy. And so for me, the inspiration for the personal narrative came with Danny. Before Danny died, I went to the Truth and Reconciliation Commission hearings here in Edmonton.
Okay.
And I considered myself well informed about Indigenous issues and residential schools and such. And I was not prepared. I was not prepared for the personal testimony and the profound impact that had on me, to really understand not just what had happened, but what it had done to people in their lives. So then a month later, Danny died, and you kind of have that feeling that you will never get up or eat or breathe or live. And then I thought back to the Truth and Reconciliation Commission hearings, and the people who were speaking there had faced multiple losses. They had lost Danny's and Danny's and Danny's over again. And I thought, well, these people, they're walking, they're talking, but they're also sharing their story. And what moved me and really brought it home to me how damaging residential schools were was not reading the history books, was not reading the reports, was not understanding the numbers. It was hearing those personal stories.
Yeah.
So I thought, it's that personal stories are transformative, and that is really what we have been using. Because I'm not a drug policy expert. Well, I have become one.
It sounds like you are now.
but I didn't set out to do that. It's not my it's not my profession. It's not what I studied in university. But it starts with the personal stories. And whenever I talk about drug policy, all my presentations start again.
Yeah. And I think
Celebrate Earth Day, April 22nd, with a soundscape of a Staturna Island, British Columbia wetland. Follow the 24-hour circadian rhythm as it unfolds in sync with your local time. The voices of the frogs, birds, insects, and their environment take over the airwaves for this experience in slow radio. The Wetland broadcast is created by artists Brady Marks and Mark Timmings. Crack open a virtual window and connect your everyday activities to the Wetland soundscape. April 22nd, all day, Earth Day. To learn more, visit wetlandproject.com.
Want to know what's up at UBC? Read the UBC. It's only the largest student newspaper in Western Canada, and it's written and edited entirely by UBC students. The UBC is your source for on-campus news, culture, and sports. New editions come out every Monday and Thursday. For breaking news, as well as amazing videos and blogs, check out ubc.ca.
Oh my lord, I need a creative outlet. How on earth can I channel everything that's inside of me?
You know you can do that at CITR and Discorder, right?
Pardon me?
Yeah, you can illustrate for Discorder magazine or take photographs of events and artists, and they can teach you how to use Photoshop in their media lab.
That is so exhilarating. It fills my soul with lightning.
Yeah, just email volunteer@citr.ca and they can help you get started, or just come into the station whenever.
I wouldn't miss it for the world.
We are so happy because Fund Drive 2019 is officially over. What a great feeling. To everyone who donated their time, their energy, and their money, the people who forgot to donate now but will online at citr.ca/donate, those who couldn't donate this year but will next year, and to our community as a whole. CITR and Discorder just want to say...
All right.
And we're back. You're listening to Democracy Watch on CITR 101.9 FM. Thanks for tuning in. So we just heard a little radio documentary on Vancouver's Opioid Day of Action, which took place downtown this Tuesday.
Right, and we're going to continue on the subject for a while long. As we mentioned at the top of the show, this April is the 3rd anniversary of BC's public health emergency.
Yeah, this emergency was declared in 2016 because of an alarming rise in deaths caused by overdose. And in large part, these deaths are due to contaminated drug supply, which contains extremely powerful drugs like fentanyl and carfentanil.
So since this emergency has been waging for 3 years, folks who would like it to end have had to get creative. And one of those people is Garth Mullins, who isn't getting very far lobbying government, and instead he decided to start a podcast.
Yeah, you may have heard of it, as it's getting a lot of traction. The podcast we're talking about is Crackdown, and it's available wherever you get your podcasts.
Yeah, Crackdown is a radical approach to reporting on Canada's opioid crisis. CHR's Ben Mussett was able to speak with Garth about this podcast and what makes it so radical and special. And he spoke with Garth about how he thinks change might come about for drug users in Canada. So let's take a listen to this interview. On April 16th, Vancouver held a march in the downtown east side, demanding action on the opioid crisis. The event marked the 3rd anniversary of BC's public health emergency. This so-called emergency declaration is in response to a spike in overdose deaths province-wide. Almost 1,500 people died of illicit substance overdose in 2018. The day before this Opioid Day of Action, CITR reporter Ben Mussett spoke with journalist and drug advocate Garth Mullins. Garth is the host and executive producer of Crackdown, a bold new Vancouver-based podcast covering Canada's opioid crisis. Crackdown describes the battle against drug users as a war, and the users themselves as war correspondents. Crackdown is compelling and unique in its approach, in part because it's led by drug users themselves. In Garth's conversation with Ben, he provides backstory on Crackdown and discusses the role drug policy plays in the continued opioid crisis. Take a listen.
So I guess I'll just start off by asking, how did the podcast come together, Crackdown?
Well, I guess, I've been injection heroin user from way back in the day, and I'm on methadone now. But I've also worked in community radio. I've been a radio documentarian, and so I was kind of already biased for that kind of radio storytelling process. And then on some of the activism that I was doing, me and groups of people wound up in meetings with government, and we realized they never believed us. They just, as drug users, they just thought that we were full of shit. And so we started bringing research and academics with us, specifically this guy, Dr. Ryan McNeil, who's a research scientist for the BC Centre on Substance Use and UBC School of Medicine assistant prof there. And once we started doing that, the government people weren't so quick to dismiss us. And me and him and a bunch of other people were talking, me and that guy Ryan, a bunch of people were talking, saying maybe we should try and expand the audience for this sort of thing beyond a few government officials. And so that's when the idea was sort of born.
I see. So you said they thought you guys were full of shit up until you kind of had an academic joining you?
That's right. So, we would report things that we're seeing on the street or experiencing or that the community was thinking. And the various government officials and ministers would just, they'd pat you on the head, maybe say, oh, thank you, we'll note that or whatever. But you could tell that they didn't take it seriously. You could tell that they thought drug users were up to something, that we were trying to pull a scam, or we just didn't understand. The world is complicated. Policy is difficult. We're too simple. So when we had a researcher with us that walked them through the science, the evidence, the studies that had been conducted, which showed the same thing that we were saying, then they had to start taking it more seriously. This hasn't resulted in the kind of radical policy change that we're looking for, but it at least kind of mitigated the easy dismissal that they often treated us with.
Right. So I guess that ties into my next question about why you think it's so important that the war correspondents, as you call them, are placed front and center in the fight against the overdose crisis, that their stories are heard.
Sure. I mean, this is the third year right now, today, or I guess yesterday, exactly 3 years since the declaration of a public health emergency in BC. But it's a public health emergency without a public health response. And the sort of only thing that they seem to be able to do by declaring an emergency is produce better data on the number of deaths. So we get monthly coroner statistics, which are broken down by some demographics and region, and that wasn't really possible before. And we just think that, people don't necessarily react in the same way to numbers as they do to people. And so we want to show people. But also, there's no emergency that lasts for years and years and years. It's not a public health emergency. It's a public policy emergency. And to us, it feels like a war. So we decided, let's cover it like a war. There's equivalent amounts of deaths as many conflicts Canada and the U.S. has been involved in. There's occupying paramilitary forces, kind of like, police. In Vancouver, the police have a tank. There's a lot of arrests. There's a lot of people in prison. There's a lot that parallels war, and it definitely feels like a war. So we thought we would cover it like that.
Could you unwrap what you said earlier about how, if I understand you correctly, you said it wasn't a public health emergency, the overdose crisis, but it's a public policy emergency?
Sure. Yeah. I mean, the most dangerous thing about drugs is that they're illegal. So it's not something about the molecule or something about the person. It's something about the organization of society. So we've taken a behavior, made it illegal, and made it much, much, much more dangerous in simply passing those laws and having those policies. So it's not a force of nature. It's not something that's occurring and those in charge are kind of wringing their hands about what to do. The people in charge are the people who are causing it, and there's no question. And we sometimes bring our scientist, Ryan, to make the point through research that's found how criminalizing drug use makes things so much more deadly, how the illegal drug market makes drugs toxic, and how that process has been working its way around for 110 years in Canada.
Yeah, you talk about the dire need for a safe supply of drugs in your first episode. I know that the prospect of something like that occurring in Canada or anywhere is largely dependent on who's in power at the time, but are you hopeful that this might soon become closer to a reality in a place like British Columbia? What is in the way of creating a safe supply of drugs?
Two questions. Am I hopeful? No, I'm not hopeful that any government's going to do it. Nobody is going to give us anything good unless we twist their arm. But that's the whole history of human beings, right? Like, the powerful do not help or share unless we compel them to. It's always this way. I mean, everything that's good in our society, from healthcare to having a weekend, has been won through struggle. The fact of safe injection sites are here. They were won through struggle, through opening them illegally first. And so what's the barrier to safe supply right now? I guess it's our ability to organize. When we, as activists and drug users and supporters, organize ourselves sufficiently, when we raise the political cost to government and to leaders of doing nothing, then maybe it will come.
And so you think that's the reason why we haven't seen more kind of meaningful, comprehensive action on this crisis, because the organized action hasn't been to a level that has gotten the government's attention?
Yeah, probably. I mean, certainly drug users right now, we don't have political power and we don't have economic power. It's mostly because we're not organized. There are so many drug users across society. People you see on TV are mostly using in an alley or something like that, but really drug users are everywhere. When we organize because this is something that affects people at work, in the workplace, when we organize with trade unions, when we organize with people in the health sector, when all those people are organized together and demanding something, and willing to engage in civil disobedience to get it, and to be very big disruptive pains in the ass to government, then yeah, we might see something like that.
Right. But I also imagine that you, as you said earlier, the importance of the personal narrative of looking beyond just the numbers and the stats, but at the people who are affected by the overdose crisis, whether it's a user himself or herself, or whether it's their family and friends. That's, I'm not going to say equally as important, but I imagine that's also significantly important, and just in terms of fighting against the stigma.
Yeah, definitely. I think a lot of it is that people don't necessarily recognize drug users from how we're mostly portrayed in the media, but we're very familiar to people. We're in their families and workplaces and churches and communities. And I guess part of this is starting to show that, is starting to show who drug users are. And I want people to see what I see, which is a bunch of people who are activists and experts and super resilient, excellent people. And if more people get to meet them, then, maybe that starts to change people's view too, makes that organizing all that much easier. Right now we have such forces of backlash at work. We think about the kind of governments in the center, like in BC and in Ottawa right now, that aren't really doing much. And then the rising governments to the right, like the Jason Kenney government that could be, or the Doug Ford government that is, that are actively hostile to us. The more we organize and show who we are through that kind of storytelling, the more we can start to undermine knee-jerk support that sometimes the people like Ford and Kenney and Trump get.
Right. I think I just have one last question, and it's just, slightly off topic, but I was curious if you're familiar with the podcast Dopey, the American podcast.
Yep.
Dopey.
Yeah.
It's quite a bit of, it's changed quite a bit since when it started, and it's still different from Crackdown. But what are your thoughts on that podcast?
I heard about it through This American Life, And so I heard bits of it on there, and I just, one of the hosts overdosed and died, right?
Mm-hmm.
And that's just I think we probably have a lot of political differences with that podcast, but I can't help but having my heart go out to them, because we're in the same place. Like we started off, we had our editorial board of 8 people, and that included Sharif Kiwadden, who was my friend for years, and she's gone now too. And you realize that making radio during a war sort of means that you might lose people. And I feel for that guy on Dopey who's lost his friend there. And it's maybe it's good that they make that so that people can get to know that and also get to know that loss a little bit.
Yeah, again, kind of humanizing the crisis, because I think a lot of people just hear about the numbers, which should be shocking in themselves, the number of overdoses in recent years. But like wars, sometimes those become so abstract to become almost meaningless for people.
I think sometimes we're a little bit of an innumerate society too. Like you listen to the way that numbers are reported in a budget speech, and they'll say that this new program will cost $7 million, and they'll really emphasize that. Except for you're talking about a budget of $300 billion. What does that even mean? Like there's no reckoning it. So maybe telling what the stats mean, like the overdose crisis right now is affecting the average lifespan. It's beyond, car crashes and suicides and murders and other things. It's beyond what Canada loses in wars. Maybe giving some kind of, something to compare it to.
Providing some context.
Yeah.
Yeah. Thanks for talking to me today, Garth. I really appreciate it. And I said before, I love the podcast.
Thanks very much. Good luck with it. This article comes in.
We'll see. I'm actually done.
Thanks for listening. Interview by Ben Musset. Editing and production, Alex DeBoer. And our backing track is Wasteland by Silicon Transmitter.